Hey fellow baby boomers, I'm assuming you're here because you hurt your back. Your back is out and you want to know what to do about it. Okay, the first thing you need to do is go to the website babyboomercouchpotato.com and check the blogs and check the blog for muscular back injury and take a look at that. It'll tell you when you should be doing these exercises, if you should be doing these exercises, you know, how to react the day of the injury, and you know, when to see a doctor. So assuming that you've done that, and this is about 2 or 3 days later after your back has gone out, you're feeling a little better, you've taken some anti-inflammatories, and now you need to get these muscles all around your lower back moving. We now know from lots of studies that bed rest is not the best thing for a muscular injury in your back. Exercises moving around. So we're going to do some very low impact exercises here that'll help accomplish that. First thing you want to do, just like any other exercise program, you want to warm up. Now, of course, you got a sore back, so you're not going to be doing any heavy duty aerobics, but you want to walk around for a while on a nice flat surface and just get your heart rate up a little bit, get some blood flowing, you know, make sure you're nice and warm before you start these little exercises. All right. So the first thing we're going to do, unfortunately, you need to get down on your back. So let's start out this way. Just lay on your back, nice and slow. Take it nice and easy coming down. Keep your feet flat on the floor, your knees pointing up. And the first thing we're going to do is really, really simple. And we need to know this for a lot of exercises, even later on. We need to know how to do a pelvic tilt. So our pelvis is right in here, and we have this little separation between our backs and the floor if we're laying flat. So what we want to do is get rid of that. So we take our pelvis and we move it in. It's just a little movement like that. And now I can't get my hand underneath here. You know, and bring it back and bring it back again. Bring our pelvis down and then kind of move it towards our belly button. And that flattens out the back. And you want to do this about 6 or 7 times. And it should feel good, actually. Especially if you have a sore back. And each one of these little exercise stretch kind of things that we'll be doing right now, you should hold them for about 10 seconds each. But we're not going to do that because of time, and I have a lot of things I want to show you. So you bring your pelvis in, breathe out, take a nice inhale in, bring your pelvis down, and bring it up. Now you want to do that, you know, several times. I don't know, hopefully you can see this movement. So here I have this space. I can get my hand underneath my back. When I bring my pelvis in, there's no way I can do that. Okay? And we'll bring it up. Okay, so that's the first thing we're going to do. The next thing we'll do, we're going to loosen our lumbar spine a little more. We're going to bring our legs both out, our hands down, flat on the ground, shoulders down, relax our jaw. We're just working here, you know, don't be tensed up. Be nice and loose down here. And we'll keep our right leg down and bring our left leg up with our knee facing the ceiling. You can bring your hands out to a T or close to a T and just slowly bring it over to the side. You don't have to come all the way down. What you do want to make sure is that your shoulders don't come up. You don't want to be doing this kind of thing. Keep your shoulders flat on the ground and just come down. You would hold that for 10 seconds, bring it back up, bring this leg down, this one up, and do the same thing. And you would hold them for 10 seconds. And you might want to do this 3 or 4 times on each side. And you'll feel it. You'll feel the stretch in your lower back. And you'll be surprised it's also working our oblique muscles that are really important for protecting our lower back. I'm going to show you what those are in a minute. Okay, so now we're going to bring both knees in, and the same thing. We're going to keep our knees glued together, our arms out. We're going to slowly come over to the right as far as we can without our shoulder coming up. If our shoulder starts to come up, we've gone too far. If we're very flexible, and I have a feeling most of us are not, you know, you can come all the way down and touch the ground, hold it for 10 seconds, come on up, do the same thing on the other side, hold it, come on up. And again, we'll do that 2 or 3 times for 10 seconds on each side. Try to keep the knees together. That's not so easy even for me. And come up. And that is also working our oblique muscles. And the oblique muscles are these muscles that are around the side. So basically what we're doing, we're working our core, but the really important parts for protecting your lower back are your abdominal muscles right in here, or these oblique muscles that are like our natural girdle, kind of holds everything together, including our lower back. It protects the spine. There are some muscles in the lower back that we're working, but this big muscle on our cheek is our glute muscle, very important for your lower back. And your hamstrings are important too, and that's this big muscle in here. Okay? Let's get back down. I think we'll do a couple of bridges. Same thing, lie flat on the ground, hands down on your sides, knees up. And now what we're going to do, we're going to lift our butts up in the air and keep our shoulders and our upper back down on the floor. And get a nice stretch in that lower back. We want our belly kind of pushing up towards the ceiling. And your feet could be in close to your butt. And you come down very slowly, one vertebra at a time. And then back up. Now when we actually start to do some more intense exercises to really strengthen this middle part of the body, our core, you know, we'll do things by putting our leg up and, you know, going up and down, but we're not in any shape to do that right now if we have a sore back. And we'll have more advanced back exercises on the website, babyboomercouchpotato.com, and on YouTube, so you can check them out once you're feeling better. And come down slowly. And again, you would do that 3 or 4 times, and it feels good. You know, when you're done with this, your back is going to feel better. You know, it really should. If it doesn't, then maybe you need to rest just one more day, or maybe you need to see a doctor because maybe it's something a little more severe than just a muscle pull in your back. Okay, the next thing I guess we'll do some, just a few crunches. Again, we want to strengthen our abdominals, really important. So we'll have our knees up. This is a very little move. We're going to do our pelvic tilt again. We're going to take our pelvis and move it in so that there's no space between our back and the floor, and we're going to hold it like that. Okay? We're not going to clasp our hands behind our head because we don't want to pull our neck. We're going to put our hands next to the sides of our head. And we're just going to come up a little bit. Now just this little tiny bit, I feel my abdominals really getting hard. Now even if you have a belly, some fat over you have abdominals, you just might have some fat over them, you're still underneath that fat, you're going to feel that tension, and that's what you want to feel. And then slowly come down. Come on up, hold it a second, feel that tension, and down, up, and down. And you want to do about 10 of those. And again, you know, at least hold 5 or 6 seconds each time you come up. And then you can take a 10-second rest and do them again. All right, now since we're down here and we're doing that, we might as well work the obliques a little bit, these side muscles that are our internal girdle that hold everything together. Same thing, hands here, pelvic tilt in. We're going to lift our 2 legs up. We're going to put out the right leg, and we'll take the right elbow and go towards the left knee. A little bit, you know. Slowly come down, do the opposite, hold it, breathe in and out, and down, up, and down, and down, and we would do again about 10 of those or so. And since we're here, I'm going to show you one other thing. You'll see this online. A lot of trainers do this knee to chest exercise, and there's a couple of things I want to tell you about it. The way you normally see it done, you bring both legs up, stick out, in this case, the left knee, and then you would pull in the right knee. The only problem with that is these exercises are designed for baby boomer couch potatoes. A lot of us have not the best bone density. We may have some other issues, especially with our knees. So I don't like to do it that way. I like to hold on underneath on the thigh, and you can lift your head up if you want, or you can keep it down and just pull this in. And now I'm still getting a nice stretch here in my my hamstring and my glute, you know, and switch and pull it in. Now if I bring my shoulders up, you know, not so much my neck, but my shoulders, I'm now tightening my abdominals, so I'm working them too, you know, if you can do that. Now, you know, these exercises are for somebody with a sore back, so maybe you can't do that. If you feel a little strain, that's excellent. If you feel pain, skip that exercise. You know, you don't want to ever feel any pain. So these are exercises to do after the fairly severe pain has subsided. Okay. I guess we should do a few back extensions, for sure. They're pretty easy to do. Lots of different ways to do them, but we'll just do them. We'll do the first one with our hands underneath our shoulders, and we're just going to lift up a little bit like this. Now I feel this little bit, I can really feel right in here, and that's where I should. And slowly come down. You know, we'll bring it up, hold it, again, 10 seconds if you can, and very slowly come down. As we get more flexible and you feel better, you know, and stronger, you know, you can come all the way up like this, but for now I wouldn't recommend that. And come down. Another way to do it is put your arms out, have your legs nice and straight, just bring up your right arm, and you can bring up your left leg at the same time, and slowly come down, hold it 10 seconds, and down, and do, you know, again, 10 of those. To work a little more back in here on your glutes and that part of your lower back, make a little pillow for your head, bring it down, have your legs nice and straight, just lift them up and down, and I can really feel this, you know, you will be able to too. And then as you get stronger and we get more advanced, you know, then you would bring them out and, you know, click your heels together, or, you know, do all kinds of different things, and it's really quite intense on the lower back, but it really strengthens it, and that's, you know, ultimately what we want to do. The only other things we'll do, we'll just stretch a little bit. I don't really do too much for the hamstrings. You know, for your hamstrings, good to have a chair handy, or do them up against the wall. Just do some squats, come down, slowly stand up. I'm cutting my head off here. You know, do a few of those to strengthen your hamstrings. Child's pose, when you're all done, open up your knees, sit on your butt, push out, hold that stretch, really push this butt back, and come on up. And you can just do a little bit of a twist. Don't do too much, because obviously we have sore backs. You know, on either side, just nice and easy. You know, we might want to stretch our necks out just a little bit. You know, bring it over to the right, center, down, center to the left, center, and do that a bunch of times, and that's it.